All right, so now we're going to talk about some management. We should be screening every patient we see for intimate partner violence. We should be screening patients alone. We need to reassure the client that their privacy will be respected. We will not report things that we are not mandated to report without their permission. We should remain non-judgmental even of the abuser. If someone discloses abuse to you, your immediate response may be, what a terrible person that is. But remember that abused people are often bonded to their abusers. And if we attack the abuser, they may actually come defend the abuser and come to their defense, and we've now lost the opportunity to help them. We focus on the behavior, not the person. So an appropriate response if someone discloses, my wife hits me if I don't do what she wants, would be that that's not okay. We focus on the behavior. That's not okay. You don't deserve to be hit. Rather than the person, your wife's a terrible person, you need to leave her. That usually doesn't get much of a response. We need to create a caring environment, and we need to demonstrate that we are willing to talk. So what would be an appropriate way to begin this conversation? Because it's really awkward and probably not effective to just walk in the room and say, hey, is your partner abusing you? One way that's been pretty effective is to ask the patient, are you safe at home? Or do you feel safe at home? And again, we want to ask that question when that person has some privacy, when there's no one else in the room, so that if the abuser is with them, they can feel free to answer. Some signs of abuse, or some signs that would give us a red flag: if the explanation of the injury doesn't match, or the patient has an injury and they're hesitant to explain it. The patient may have an inappropriate affect. They are laughing when they have a very serious injury, maybe, or they're crying over something very minor. An inappropriate affect. Delayed reporting of the injury. The injury doesn't get reported. They come 2 or 3 days later and they have a serious injury. The pattern of injury can indicate abuse. You may see a handprint or a ligature mark. Lack of eye contact, but remember, this can also be a cultural norm for some people, and that some individuals struggle with eye contact. So that's not necessarily, if that's the only sign, that's probably not a sign of abuse. If anxiety increases when the partner is present, or if the person is looking to their partner every time a question is asked, they're looking to the partner before they answer. The partner may do most of the talking or may not leave the room willingly. Overuse of health services. So this seems to contradict, but what we see sometimes is someone who goes to the doctor frequently for minor things, or for things that are really hard to pinpoint. We don't really know what's going on, but then they may not treat a serious injury. Missing appointments, and that may be because of either not being allowed to go by the abuser, or covering up the effects of abuse. If someone is in a violent relationship, we also should be evaluating the risk for serious injury and homicide. There actually is a screening tool for evaluating the risk of homicide in a relationship that law enforcement in some places is using. Law enforcement isn't typically great with sexual assault or intimate partner violence. They often react in ways that are not helpful. But some risk factors. If someone, you need to understand what I'm saying, okay? I'm not saying that these risk factors by themselves are risk factors for homicide. In a healthy relationship, people can have guns in their home. But in an abusive relationship, if these things are in place, the risk of homicide is higher. The risk is higher that someone will die. So in an abusive relationship, the presence of a gun in the home threatens to kill, or the abused partner believes that the abuser will kill them. or attempts to choke. Okay, those three things are the highest risk factors. The biggest red flags for someone in this relationship is likely to die. Separation or estrangement, threats or violence toward children, escalating violence, threatened or used a weapon, extreme jealousy, forced sex. There's also some increased risk with drug or serious alcohol abuse. There's actually tools that are used by law enforcement. Not all law enforcement officers are trained in it. Not all departments take it very seriously. But there are lethality risk assessments that can be used. Risk factors in the relationship seem to be similar for homicide of the abused or the abuser. Those are not risk factors, just that the abused person will be murdered. They also increase the risk that the abuser will die because of self-defense. Okay, so we're going to look in the next section at some specific interventions. And you're probably thinking, well, you need to tell people to get out now. We're going to talk in the next section about why that's not necessarily the best intervention.